You are listening to a Coalition of Peers podcast, part 1 of Marching Mouths, a panel on peer leadership in the Downtown Eastside. This panel is part of the Vancouver Community Coalition Against Prohibition and Overdoses Beware the Ides of March event series, recorded March 17th, 2020.
I'm Collie, and I work, I'm part of the Coalition of Peers Dismantling the Drug War, but I also work for different organizations too, but mainly my stuff is around youth. I'm working with youth that use drugs and also inject drugs, to making them make safer and healthier choices when they do it, and just finding safe places for them to do their drugs. So.
I'm Al Fowler with various organizations in Vancouver here, the Coalition of Peers Dismantling the Drug War, BC Association of People on Opiate Maintenance. I do work with Vandu. I do work with BC Yukon Drug War Survivors Association, and yeah, that's me.
Hey, I'm Eris Nix. I'll be helping to facilitate this discussion. I'm currently the project coordinator with the Coalition of Peers Dismantling the Drug War. I'm also a community organizer with Toro. I also help facilitate a coalition between the Western Aboriginal Harm Reduction Society, Dudes Club, the Coalition of Peers Dismantling the Drug War, and the Tenant Overdose Response Organizers called the Vancouver Community Coalition Against Prohibition and Overdose, and that's who's assisting in putting on this panel.
Hi, I'm Danielle LaFrance. I'm the community librarian for the Downtown Eastside Strathcona area, working out of the newer branch, Nutsamut Strathcona. Been working there for 3 years and working and very active in the neighborhood over 10 years now.
And I'm Melissa, and I'm the secretary for WARS.
I'm Samona. I'm the Ethical Substance Use Navigator. I'm also the treasurer for BC Yukon Association of Drug War Survivors, the secretary for Vandy, among with many others. Going to be president.
Good.
Yeah, so I guess the kind of premise to our current recording is that coronavirus, aka COVID-19, aka the Roni, has swept across the entire globe. So this current iteration of this panel is being done, in a secluded setting of social isolation to ensure that everyone's health and safety needs are being met. But I guess we kind of want to open the panel and just touch on this because it's probably what's on everyone's minds. How people in the community are engaging with other folks to ensure that they kind of understand what's going on, understand if they're using drugs, how they can be safe, how they're preventing panic from occurring in a widespread kind of way, especially when people are so, densely packed into the neighborhood. Whether it's the fact that they're living outside or they're living in tiny little box SRO rooms with shared bathroom and 20 people on one floor. So
the way we're doing it with work with BCH and stuff like that, but also I work with a lot of people. So it's we're trying to any type of people start spreading messages about insight or anything like that about them closing, because they won't, because they're life-saving supports. And so just making sure that people know that they're not going to be closing. We have measures in place to make sure that they don't get closed, and also just making sure people are washing their hands, even though we're getting low on hand sanitizer, but making when people go in to use OPS sites and stuff to use hand sanitizer and stuff like that. Also just making sure that people are get the right messaging for this. For the COVID too, so just making sure that there's right messaging around out there, and so people aren't spreading misinformation, because that happens a lot.
At Vandy, we opened a separate room for anybody that we think might be infected, so that they can still go use and not infect everybody else.
And also just making sure that people that use drugs and are in quarantine, to make sure they have supplies, we're able to deliver that in a safe way too. And so, but it's not able to deliver drugs, which kind of sucks, but
that's where I come in.
Yes. So I'm Al. I've been involved in community stuff since 2011. I got hooked up with a slumlord, and that's when I started fighting, because he was a real dirtbag, George Woolsey, and that's when I got involved in community leadership. But part of community leadership is we have to look after our people, we have to look after ourselves, but we have to be not freaking out about it. You know, we just need to keep ourselves safe, and you know, don't spread the panic, but just common sense. And it's hard being a leader. I even hate that word kind of down here, because I'm just another individual like everybody else. We have to talk to everybody. We have to talk to the politicians. We have to talk to the peers. We have to talk to the peer groups. So in that aspect, it's really hard sometimes to keep a cool head and to keep the conversation mainstream, because if we're angry, you know, our people are dying now already, and this might even make it 3-4 times as worse. But we won't touch on that right now. But so being leadership downtown Eastside is, you know, dealing with both sides of the fence, and have to go to these meetings, but sometimes you're perceived as sucking up, or you know, you're on their side of the fence. Well, the thing is I believe that us in this room, we are here for our community down here. You know, and we're not in it for the glory. We're not in it for the money, because there ain't no money in it. For one thing, you know, it's just we have to stay together, and we have to not panic, and you know, just keep ourselves alive.
And the biggest thing too is that we're able to, like, for messaging and stuff like that, we're able to tell people that are picking up pipe or like any type of harm reduction supplies, but mainly pipes, is like making sure they grab extra mouthpieces. Like, we're giving people extra mouthpieces even if they don't want it, and extra alcohol swabs and stuff to make sure that they know stuff around that.
Well, and I think this is like an interesting facet of this issue, you know, that maybe some of us here have experienced, is a shortage of glassware that we're currently experiencing, where we're both being told it's a supply side issue and they can't manufacture enough glassware for the communities, and that someone, you know, somewhere along the line misappropriated some funding and now there's a short on glassware. So do you think there are easy ways for folks to deal with this, or do you think, you know, there's advice you can give people on the glassware shortage? Or
the advice I can give people on glassware shortage is that, yes, we know that there's a shortage of glassware, and just try to be patient. But I know it's difficult to be patient, especially when you're needing a pipe now and then. Like for bubble pipes, there's a big shortage on it. There's going to be a shortage on it, and there's issues, like there's a big issue with that. But like, I really can't there's nothing I can really say that can help, because I know people are angry about that. But crack pipes, there's a lot of crack pipes out there. It's just, you need to find out where, and there's different places where they have them. Some people are overstocked with them, so they're just not handing them out as much as they should. Like, we're really trying to encourage the services that are handing out pipes to hand out more than usual for the crack pipes anyways. For the bubble pipes, it's just another issue that we're gonna have to do.
So we have to think back, you know, to a couple decades ago when a supply of pipes wasn't available. You'd go to the stores, you'd buy the little things with the rows in it, and you looked after your pipe. You know, I had pipes that I'd use for a month. You get a good Durex pipe and just keep it for yourself, because that's how it is. Like, you know, I lived up north and stuff, so whenever I went up there, I'd have to take, you know, a few with me, and if they were gone, they were gone. So it's just common sense from my point of view.
You know, I think what I've heard a lot is that we need to find people, other leaders in the community who are experienced glass blowers. But this leads into another issue where it's like, especially with COVID, you know, if everything's like a respiratory transmission, are they ensuring that everything's sanitized, blah, 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 blah. And I'm like, you know, in my opinion, we wouldn't even be in this problem to begin with if some select institutions in Vancouver that shall not be named actually provided, you know, these supplies to folks en masse.
Our managers didn't allocate funds somewhere else. They shouldn't have stuff like that, because that shouldn't have happened, but it does happen, I guess.
Melissa?
On our outreach, we're handing out a lot more pipes. So we're also trying to hand out updated information that I get online from BCH. So to tell the outreach leaders if they have any questions while they're out. So keeping them informed.
And when it comes to buying dope, if it gets to the point where we figure that's going to start being contaminated, I know it's kind of a wish, imaginary thing, but so if you get your dope ahead of time, put it away for the 12 hours, and then you should be good to go. You should be, you know, it's just a thought, right? I don't know if that's, you know, going to
Well, I do think this is like a big thing with the virus specifically, is the idea that supply chains are going to be, disrupted. Like, let's say, for example, you go to a certain place every day to buy your dope, and then that place closes down. You're not going to be able to find your dealer very easily. So I think it's good for everyone to be reminding folks, make sure you have contingency plans if where you're normally going to buy your dope gets shut down. Make sure if you're getting dope from a new person, you're going slowly, ideally with someone else who has naloxone. These kinds of things are like imperative to be telling people, especially since we've seen so many community centers, libraries, kind of, et cetera, shutting down. Collie?
And the biggest thing too is that it's what kind of sucks too. If you're someone that uses down or uses opiates, you're able to get OATs if you go into quarantine or anything like that. You have that option. There's options for you to go into if you go into quarantine, or you're just looking for another option for things like that. You have an option if you're on for OATs. They're willing to give you that prescription for it and deliver it, and give you that give you like how many weeks you were stuck down for. But if you're someone that uses stimulants, you're fucked. A lot of us are going to be going into immediate withdrawal.
Actually, no. I had a meeting yesterday. I won't say with who, but they said that they were looking into getting safe supply because the borders are closed. Like, it's going to be harder to get it for all types of drugs.
So they'll prescribe Dexedrine?
They're being selective of that though too. At the meeting that we had today, they were being selective of people that are going to get it.
Yeah.
I was told that anybody that was quarantined that needed it would get it.
I'm going to quarantine myself.
I was thinking the same thing. Fuck, not wrong, man. Before you wait 2 days.
I'm in quarantine here. Can you bring me by like 45 Dexies?
I'm going to be in quarantine for about a half ounce or so.
I'll call you when that's done.
But no, with the OAT, because with BC Association of People on Opiate Main, so we've been watching that, and they are lifting the restrictions and stuff, and I agree with Collie there that we need to do something about stimulants on that same thing, whether we're going to have to kick down some doors and, grab some scruffs of the necks and say, hey, what about everybody else?
And the biggest thing around the stimulants too is that there's so many fucking restrictions on stimulant medications like Dexedrine or Adderall and Ritalin. That's the reason why it's gonna be difficult to create a safe supply in this crisis right now, because it's just that's one of the reasons why that hasn't rolled out yet. And so a lot of doctors are wanting to prescribe it, but they can't because they can lose their license and stuff. There's a lot of dumb reasons why.
Well, I have 2 points to make too, and one is that I'm just like, you're going to get the drug somewhere else. I've never been prescribed any kind of amphetamine in my life, and I've always had amphetamines. Since for the last 15 or 16 years of using drugs, I've always had pills, and I'm like, can't get them from the fucking doctor though. And the second thing is, I don't know if anyone remembered this, who was it, Bonnie Henry or someone was stimulant user, someone with a stimulant use disorder cannot live a normal life or whatever, Colin.
It wasn't Bonnie Henry. It was
a normal life.
Yeah, it was the director medical officer of BCH said that when she put out a report about the opioid crisis, it still makes me laugh that it says that in a report that probably stimulant users can't live normal lives. And I'm like, well, fuck, I'm a meth user that uses meth every day, and apparently I can't live a normal life, so I probably can't get my job.
Yeah. I think this is a good segue. Before the COVID-19, one of our intentions of having this panel is looking at that intersection between when an institution like VCH or the city of Vancouver takes over the narrative of harm reduction initiatives, and that what that does to folks who have been at this work for 20 years plus. If you can speak to just that tension with and Al, you kind of made reference to this as well, having to speak having to change your language a bit when you're working with politicians and...
Yeah, well, as of now, Melissa and I, we both work with the city... Sorry, did I cut you off?
No, that's...
We both work with the city's Safe Supply Working Group. But they are no longer having any meetings because of the whole thing. So how the hell are we going to make any progress to help with this situation if we can't deal with this situation, right?
And I asked about that. I said, what about a teleconference? And they said, we'll get back to you because we're overloaded with work dealing with the virus.
Yeah. But they're all getting a paycheck, it's really hurting down here because a lot of us rely on stipends and honorariums to, supplement our income and survive. That's another thing coming now, right?
Yeah. the thing I was going to mention too about like the messaging that's going out there is that they forget about stimulants. Like cocaine's fine, but like they put out, but when it comes to meth, it's a whole different story. So stigmatized of meth is just so damn bad that it's just like for like as someone that uses meth, it's not heartbreaking. It's just really hard to be someone that uses meth because the messaging they put out there is really stigmatizing. Like, oh, you'll die from one hit. It's like, no, you won't. You maybe, but okay.
Well, I think the other thing is on like crack also, there's a ton of stigma. And as someone like, even, you know, cause I spend a lot of time in the punk scene and I smoke a ton of crack or whatever, but I'm just like, the people I'm around are like constantly doing cocaine. I've never seen so much cocaine in my life. But the second you're like, hey, want to smoke some crack? Everyone's like, oh my God, no. Get away from me. And you're like, this is, it's the same, hey, you guys, it's the same fucking thing. So I think, you know,
Or if you want to, you know,
smash anything, as soon as you
God,
touch a
no,
needle,
man.
everyone's like, you know, so I'm like...
Yeah, like the reference I put out there is like, when I mentioned to someone that I'm a meth user, they take a step back. As soon as I mention I'm a like injection meth user, they take 2 steps back. They want to be that further away from me because it's that scary because I'm apparently psychotic and stuff like that, when it's like, no, that's not who...
No, it's not like COVID. You're not going to get meth use from it.
Yeah.
That's the thing, I'm like, if the overdose crisis was contagious, imagine how many resources would have gone into it, you know.
Touch someone and you're,
Yeah.
oh, you're an addict.
Someone just...
Playing tag with each other.
I just be running around touching people.
Yeah.
Touching people with your buddy behind you selling
Holy
8 ball.
Spirit.
Yeah, exactly. Making money.
This concludes part 1 of Marching Mouths, a panel on peer leadership in the Downtown Eastside. You've been listening to a Coalition of Peers podcast.